Metadichol improves skin sensitivity and skin inflammation by inhibit the inflammatory factors. Metadichol will bind to vitamin D receptors and help strengthen immune function by increasing vitamin C levels in the body to achieve anti-inflammatory, antibacterial, and anti-allergy effects. Furthermore, metadichol increases metallothionein, protects skin from oxidation and aging, prevent damages from heavy metals and UV rays, and also prevents keratosis. Metadichol regulates the levels of cathelicidin and defensin to achieve anti-inflammatory and antibacterial effects, promotes wound healing, prevents skin inflammation, sensitivity, and itching. At the same time, metadichol increases pluripotent stem cells to promote cell regeneration and repairs damaged skin. Besides that, metadichol improves over 3,000 skin conditions including allergies, eczema, acne, diabetic wounds, psoriasis, lupus, viral and bacterial infections. Moreover, metadichol improves psoriasis. 3% of the world's population suffers from psoriasis. Psoriasis is an immune-mediated inflammatory skin disease characterized by hyperproliferation of keratinocytes. Psoriasis can appear on the scalp, ears, elbows, finger joints, back, and knees. Symptoms of psoriasis include pink or red patches, silvery white scaly skin on the surface of the patches inflamed, itchy or painful skin, redness and peeling of the scalp, or spread all over the body or even form pustules. In addition, metadichol inhibits some substances that cause overgrowth of keratinocytes. At the same time, metadichol binds to vitamin D receptors, increases metallothionein, and has strong antioxidant activity that can inhibit excessive proliferation of epidermal cells. It can also regulate immune system, thereby reduces skin damages and prevent abnormal skin cells differentiation. Metadichol improves systemic lupus erythematosus. Systemic lupus erythematosus is an autoimmune disease of unknown etiology that causes erythematous lesions on multiple parts of the body. Erythema can appear on the face, ears, shoulders, chest, and hands. Most of the patients are sensitive to the sun, which causes skin erythema often becomes severe after exposure. Metadichol will regulate the immune system by binding to vitamin D receptors, prevent immune disorder from attacking the skin tissues. Besides that, metadichol regulates the differentiation and functional activity of T and B cells, inhibits the production of autoantibodies, and reduces inflammation. Patients with systemic lupus erythematosus suffer from severe oxidative stress and systemic vasculitis, in which the permeability of blood vessels increases and causes inflammation to occur. Therefore, vitamin C supplementation is needed to improve the condition. At the same time, metadichol increases vitamin C levels in the body. It has anti-inflammatory, antibacterial, and antioxidant effects, can help to regulate immune system and reduce inflammation. Simultaneously, metadichol can also reduce inflammation caused by bacterial and viral infections. The infection of reproductive organs is a big impact to body health. If the infection left untreated, it will not only lead to infertility, but may also permanently damage our vital organs, such as the heart and brain, eventually lead to death. Metadichol can regulate our immune system to kill viruses, bacteria, fungi, mold, and reduces infection, inflammation, itchiness, and unpleasant odors. Therefore, metadichol is effective against cervicitis, vaginal infection, endometritis, syphilis, and genital herpes. Metadichol has the effect of anti-aging and prolong life. That's because it inhibits a gene called BCAT1 and a substance called sialidase that contributes to aging. In addition, telomerase plays an important role in human aging, functional activity of stem cells, and prolonging life. Telomerase is an enzyme responsible for lengthening telomeres in human cells. In addition, it prevents telomeres shorten with each cell division, increases the number of cell divisions, and at the same time it repairs damaged DNA. Our cells can divide about 40 to 60 times before apoptosis. Metadichol increases the activity of telomerase up to 16 times, increases the number of cell division, prolonging the life of cells, maintains cell density, cell mass, and quality to achieve the effect of prolonging life. Metadichol is able to help promoting the proliferation of pluripotent stem cells, regenerates and repairs cells, repairs organs function, anti-aging, and prevent degenerative diseases. At the same time, metadichol increases the function of Klotho gene by 4 to 10 times, enhances the anti-aging and anti-cancer effects, help inhibit breast cancer, pancreatic cancer, arteriosclerosis, diabetes, and degenerative diseases. In addition, metadichol helps the body achieve anti-aging, promotes metabolism, improves energy level, and prevents degenerative diseases by promoting the synthesis of NMN. Moreover, metadichol helps to protect and maintain the length of telomeres by increasing the level of vitamin C and achieve antioxidation, anti-inflammation, and prevent of chronic diseases and infectious diseases. Metadichol achieves the effect of beauty skin and hair through different mechanisms. Simultaneously, metadichol increases the level of vitamin C in the body by more than 3 times. Vitamin C has high antioxidant and anti-inflammatory properties, which effectively moisturizes the skin and nourishes the hair. It can preserve collagen and inhibit melanin to achieve whitening, anti-inflammatory, and anti-wrinkle effects. In addition, metadichol helps to prolong the life cycle of skin cells by increasing the activity of telomerase up to 16 times. It can also increases pluripotent stem cells to promote skin cell regeneration, repair cells, reduce wrinkles, and firm skin. Metadichol also increases metallothionein, prevents skin from oxidation, aging, or canceration, and at the same time prevents skin from being damaged by heavy metals and UV rays, and also slows down the excessive growth of the outer layer of skin. Metadichol also regulates cathelicidins and defensins to achieve anti-inflammatory and antibacterial effects, promotes wound healing, and prevents skin inflammation. Besides that, metadichol can bind to the androgen receptors, helps regulate androgen levels, protects the hair root, improves hair quality and regeneration of the hair root. By binding to vitamin D receptors, metadichol can regulate the immune system, prevents infection of the scalp or hair roots, prevents hair loss, and promotes hair regrowth. Metadichol can achieve anti-cancer effects through multiple mechanisms. There are hundreds of genes involved in the regulation of cell production and division. Cell division becomes abnormal when these genes are mutated. As more genes are damaged, both cancer cells and tumors will be developed. Metadichol increases the function of the Klotho gene by up to 4 to 10 times, which can inhibit the growth of cancer cells. At the same time, metadichol will increase the function of the TP53 gene, which promotes the production of an anti-cancer protein called p53 to help repair damaged DNA. If the DNA cannot be repaired, the p53 protein will stop cells from dividing and signals them to die. By preventing cell division with mutated or damaged DNA, the p53 protein can help to prevent tumors from forming. Besides that, metadichol inhibits TNF, ITCAM1, CCL2, and BCAT1 to prevent cancer cells undergo metastasis. Studies have found that vitamin D deficiency not only causes bone metabolic diseases, but also be associated with autoimmune diseases, tumors, and cancer. Metadichol will regulate immune function by combining with vitamin D receptors, promotes apoptosis of cancer cells, and block cancer cells from obtaining nutrients through the formation of new blood vessels. Simultaneously, metadichol increases the level of vitamin C in the body to help regulate immune function and inhibit sialidase to achieve anti-cancer effects. Vitamin C can block the synthesis of carcinogens in the body to reduce formation of tumors. Metadichol improves the function of CD34 pluripotent stem cells that differentiated into all kinds of cells. CD34 stem cells are markers of hematopoietic progenitor cells, which are normally found in the umbilical cord and bone marrow. Cord blood has been used clinically in hematopoietic stem cell transplantation therapy to treat patients with bone marrow disorders and to rebuild the bones of cancer patients with leukemia or lymphoma for more than 40 years. It is used as a cell therapy for blood disorders. Research have shown that CD34 can participate in the transport of hematopoietic stem cells, repair or reconstruction of blood vessels, involve an inflammatory response, and also increase function of lymphocytes. Besides that, CD34 pluripotent stem cells effectively differentiate into immune cells and blood cells, such as red blood cells and platelets, which improve blood cancer, anemia, and strengthen the immunity. Therefore, Metadichol may help patients with blood cancers, as well as patients with myelodysplastic syndromes, by increasing the function of CD34. Metadichol improves thyroid hormone levels. Two main types of thyroid disease are hypothyroidism and hyperthyroidism. Hypothyroidism is when the thyroid gland does not produce enough thyroid hormones, while hyperthyroidism causes the thyroid to produce too much thyroid hormones. All thyroid-related diseases are associated with gene receptors of TNF, ICAM1, CCL2, VDR, THRA, THRB. Metadichol is an inverse agonist of thyroid cell receptors of THRA, THRB, AHR, RORC, and vitamin D receptors to modulate the levels of thyroxine, T3, T4, and thyroid-stimulating hormone. Furthermore, Metadichol is also a protein agonist with bidirectional action, which effectively will improve both hyperthyroidism and hypothyroidism by normalizing T3, T4, and antibody levels. Metadichol binds to vitamin D receptors, which will affect more than 2,900 genes, especially genes DIO1, 2, and 3. It can effectively regulate the levels of thyroid-stimulating hormone, T3 and T4. Besides that, Metadichol can improve the level of vitamin C in the body, strengthens immunity, and increases antioxidant effects, helps regulate the metabolism of the thyroid, and improves thyroid diseases caused by autoimmunity. Compared to therapeutic drugs, Metadichol is a safe and effective nutritional supplement for thyroid disease. Benign prostate hyperplasia, BPH, is the most common disease among men in the age of 50. This is due to the changes in hormone levels as we age. At the same time, men with chronic diseases or poor lifestyles such as smoking, drinking alcohol, holding urine for a long time, or sedentary. Chronic inflammation will cause prostatic congestion that resulting in urethritis, cystitis, and it may cause prostate cancer. Vitamin D deficiency in men also increases the risk of getting prostate cancer. Metadichol binds to vitamin D receptors, which can inhibit the production of kinases that cause inflammation in prostate cancer cells. This prevents the formation of blood vessels in tumors, prevent tumors from getting nutrition, and promote apoptosis to inhibit tumor metastasis. Metadichol can improve the level of vitamin C to strengthen the immune system, achieves anti-aging effect, increases androgen, reduces inflammation and infection, repairs cells, and achieve anti-cancer effects. It prevents prostate inflammation from turning into prostate cancer through different mechanism. Airway inflammation in asthma patients will trigger series of symptoms. Airway inflammation is characterized by the infiltration and accumulation of inflammatory cells in the airway. Inflammatory cells included are lymphocytes, eosinophils, neutrophils, endothelial cells, and macrophages. Many researches indicate that immune cells and the production of cytokines play an important role in the pathogenesis of asthma. Metadichol has a particle size of less than 60 nanometers that can passes through the bronchial tract, reach the lungs directly and act on the site of injury in asthma. Metadichol binds to the vitamin D receptors and improves asthma by regulating the immune response. Metadichol can increase the level of vitamin C to achieve antioxidation, strengthen immune function, reduce eosinophils in the trachea, and reduce lung damage. Metadichol inhibits excessive immune response, reduces inflammatory factors, and relieves bronchospasm. Therefore, metadichol can relieve the severity of cough, asthma, and pneumonia. Liver is the largest organ in the body and is responsible for a variety of functions, including filter harmful substances from the blood, regulate metabolism, synthesize protein, store vitamins and iron, and secrete bile. At the same time, liver is also an organ that is susceptible to infection. Long-term drug abuse, alcohol abuse, viral infection, or bad emotions will cause irreversible damage to the liver. Current research has found that vitamin D deficiency is associated with hepatitis. Viral hepatitis may lead to chronic hepatitis, cirrhosis, and liver cancer. Therefore, improving vitamin D levels may be beneficial to patients with chronic liver disease. Metadichol can bind to vitamin D receptors, which can regulate immunity, anti-inflammatory, and prevent liver fibrosis. At the same time, metadichol can inhibit chemokines, protect liver cells, sinusoidal vessels, and endothelial cells, prevent hepatitis, fatty liver, and liver cirrhosis. Besides that, metadichol can regulate the levels of ALT, AST, ALP, and GGT to protect the liver and inhibit serious complications such as chronic hepatitis, liver cirrhosis, liver failure, and liver cancer. Dialysis is needed to maintain normal metabolism for kidney failure patients. By increasing oxidative stress in patients with kidney disease, causes red blood cell destruction, also affects red blood cell production and its function. Bone marrow dysfunction will lead to high red blood cell distribution with RDW. Kidney damage, affect iron metabolism and red blood cell oxygenation. Sepsis, heart failure, coronary artery disease, stroke, acute kidney injury, and increase the risk of death in patients. Metadichol inhibits and reduces inflammatory cytokines to reduce kidney damage. Metadichol reduces red blood cell distribution with RDW, repairs red blood cells and hemoglobin to improve oxygen levels. Metadichol improves creatinine, iron, and parathyroid hormone levels in patients with kidney disease. Metadichol helps to reduce edema, prevent lung disease, regulates blood pressure and blood glucose level, reduces anemia or sepsis, and prevent the risk of heart failure, coronary artery disease, stroke, and acute kidney injury. Metadichol regulates blood pressure. Metadichol helps regulate blood pressure by binding to vitamin D receptors and acting as an inverse agonist. At the same time, metadichol increases vitamin C levels beyond what can be achieved with oral supplements. Since vitamin C is an antioxidant, it reduces C-reactive protein and cholesterol levels. Vitamin C will improve vascular function, reduce blood lipids, blood pressure, and improve vasodilation by increasing the nitric oxide level. With a molecular weight of less than 60 nanometers, metadichol can regulate systolic and diastolic blood pressure and can achieve antihypertensive and anti-inflammatory effects. Metadichol regulates blood glucose. Metadichol binds to the cell membrane receptors throughout the body to stimulate the immune system and inhibit a variety of metabolic diseases, especially diabetes, obesity, and hypertension. Besides that, metadichol is a multivariable agonist, which plays a bidirectional effect to increase or decrease the activity of insulin according to the body and also can effectively regulate insulin secretion. and blood glucose. At the same time, Metadichol also promotes the body's metabolism, regulates hormone secretion, regulates fat and blood glucose metabolism, increases insulin secretion, improves insulin sensitivity, and prevents diabetes complications by increasing adiponectin levels. Adiponectin levels also promote microvascular regeneration around damaged cells and strengthen immunity. Therefore, Metadichol is safe and effective in controlling blood glucose levels in the human body. Metadichol can prevent or improve cardiovascular and cerebrovascular diseases. Metadichol increases apolipoprotein, APOA1, which has the same effect as high-density lipoprotein, HDL. That can transport excess cholesterol in the blood to the liver for catabolism, thereby preventing arteriosclerosis. At the same time, Metadichol will increase the level of adiponectin, which effectively improves blood lipid and blood glucose metabolism. Promotes insulin secretion that prevents metabolic diseases, cardiovascular and cerebrovascular diseases. Numerous studies have also found that elevated lipoprotein A is associated with heart disease. Metadichol can inhibit the elevation of lipoprotein A levels. Prevents fat deposits from forming plaques on walls of blood vessel that causes thrombosis. To prevent cardiovascular and cerebrovascular diseases occurring. In a conclusion, Metadichol has antioxidant and anti-inflammatory effects, and can strengthen immunity. It can control and reduce inflammation and inflammatory response in the body through various mechanisms, thereby reducing the risk of chronic diseases such as hypertension, diabetes, cardiovascular and cerebrovascular disease. Depression is a common mental disorder or mental illness characterized by persistent sadness, loss of interest in people and activities. Depression negatively affects how you feel, the way you think, and how you act. It affects health and disrupts sleep quality, work, and social interaction. Scientific research has found that 3 neurotransmitters implicated in depression are serotonin, norepinephrine, and dopamine. Metadichol can improve depression. Metadichol helps reduce sleep latency, promotes deep sleep, and improves sleep quality by promoting melatonin production from the pineal gland. In addition to this, melatonin also helps relieve stress, improves negative emotions such as depression and anxiety. Metadichol also improves sleep and mood in patients by increasing serotonin levels in the brain. It plays an important role in positive emotions and is the primary neurotransmitter responsible for happiness, relaxation, and self-confidence. Therefore, it can regulate the patient's mood, appetite, and sleep quality. Metadichol may promote the synthesis of NMN, enhance brain and nerves function, increases neurotransmitters, improves energy level, reduces depression, anxiety, and fatigue. At the same time, it can also strengthen the patient's concentration and memory, improves cognitive thinking and judgment, improves the communication between brain cells, thereby enhances patient's mood and reduce depressive symptoms. Dementia is a progressive decline in memory and cognition. Dementia is caused by brain diseases or a series of cerebrovascular lesions. There are many diseases that can lead to dementia, and age-related dementia is the most common. The attention, memory, verbal, mobility, executive, and social ability of dementia patient will be deteriorated and affects their quality of life. They may have personality or behavior changes, struggles with day or night confusion, delusions, or hallucinations. Metadichol improves brain function and prevents dementia. Metadichol can achieve antioxidant and anti-inflammatory effects through the mechanism of increasing the level of vitamin C endogenously. It reduces brain nerves from damages, prevent the deterioration of brain cells, and cerebrovascular function. reduces blood lipids, blood pressure, and prevent thrombosis from damaging brain function. Metadichol promotes the synthesis of NMN, which help in anti-aging, enhances brain and nerve function, improves energy level, and effectively reduce diseases related to brain degeneration. Metadichol can also increase serum ApoA1 protein and adiponectin levels, which effectively improves blood lipid and blood glucose metabolism, promotes blood flow to brain, and avoid brain cells from hypoxia. In addition, metadichol can also reduce the elevation of D-dimer and lipoprotein A levels, reduces cerebral thrombosis effectively, prevents cerebrovascular stenosis or insufficient blood supply to the brain, and reduce diseases such as cerebral infarction or stroke that will further damage brain function. Stroke is an acute disease that seriously threatens human life and health. It has a very high morbidity, disability, and fatality rates, which seriously affects the patient's quality of life. When a blood vessel that supplies the brain is blocked, the brain cells and tissues begin to die within minutes from lack of oxygen and eventually lead to a stroke. Stroke can be divided into two categories: ischemic stroke and hemorrhagic stroke. Ischemic stroke is caused by cerebral thrombosis, leading to cerebral infarction and blockage of cerebral arteries. Hemorrhagic stroke is caused by the rupture of blood vessels in the brain, which increases pressure inside the skull and lead to brain tissue damage. Metadichol can help prevent stroke by binding to vitamin D receptors and increasing vitamin C levels to improve vascular function, reduces blood lipids, blood pressure, and avoid thrombosis. Metadichol also increases serum ApoA1 protein, which has the same effect as high-density lipoprotein, HDL. It can transport excess cholesterol in the blood to the liver for catabolism, thereby preventing cerebral arteriosclerosis. Metadichol also can increase the level of adiponectin, effectively improve blood lipid and blood glucose metabolism, promotes blood circulation, and prevents stroke. Metadichol can reduce D-dimer level to help fight thrombosis against myocardial infarction and cerebral infarction. It can also inhibit the elevation of lipoprotein A levels, prevents fat deposits from forming plaques on blood vessel walls or causes blood clots, hence reduces the risk of stroke. Rheumatoid arthritis is an autoimmune disease with chronic joint inflammation and bone destruction. Rheumatoid arthritis is more common in middle-aged women. It causes the tissue around the joints to be destroyed, induce pain, swelling, stiffness, limited mobility, and possible damage to the skin, lungs, and blood systems. This will lead to permanent joint deformity and increase the risk of disability if not properly treated. Rheumatoid arthritis patients have high levels of rheumatoid factor, C-reactive protein, and erythrocyte sedimentation rate. Patients with rheumatoid arthritis have low bone mineral density, which will lead to the development of osteoporosis. Both vitamin D deficiency and the production of TNF, an inflammatory factor, can worsen rheumatoid arthritis. Metadichol inhibits the elevation of rheumatoid factor, C-reactive protein, and erythrocyte sedimentation rate, which can reduce the inflammatory response. At the same time, metadichol can inhibit autoimmune diseases, reduces inflammation, and improves rheumatoid arthritis by inhibiting TNF and other inflammatory factors. By binding to vitamin D receptors, metadichol regulates calcium and phosphorus absorption to increase bone density and reduce the risk of fractures caused by osteoporosis. Therefore, metadichol can inhibit inflammation, reduces pain, reduces fracture risk, and improves joint flexibility in patients.